Hello everyone and welcome to today's episode. The topic today is emerging substance use trends and community risks. I am Shalmee, a clinical psychologist, and I'll be your host for today's episode. We are here to discuss a topic that affects every community: substance misuse. Emerging trends in substance misuse not only impact individuals but also ripple through families, workplaces, and neighborhoods. Our goal today is to provide you with actionable strategies to address these challenges, particularly focusing on the recent trends and their effects on the local communities, and steps for community-driven solutions. Thirdly, we'll look how collaborations can maximize our collective impact. Feel free to take notes and we'll share additional information and resources at the end of this episode as well. Let's get started. Let's talk about the recent trends in substance use and their impact in the beginning. Let's begin by looking at the substance use trends currently shaping our communities. The UK has witnessed noticeable changes in drug and alcohol consumption patterns over the last decade, with increasing concerns about synthetic drugs, alcohol misuse, prescription drugs, dependency, and the role of social media in influencing the young people. So let's talk about the trend number one. The first trend is synthetic drugs. Now, the use of synthetic cannabinoids and designer opioids has surged, particularly among the vulnerable population, such as young people and the homeless. Now, these substances are often marked as legal highs or safer alternatives to traditional drugs, but in reality they pose severe health risks, including the acute psychosis and paranoia. It also increased the risk of seizures and heart attacks. It also leads to higher likelihood to overdose due to the unpredictable potencies. Now, according to one of a report by the UK Home Office in 2023, the synthetic drugs used, particularly spice, has contributed to a 66% increase in drug-related hospitalizations over the last 5 years. Now, additionally, the fentanyl-related deaths in England and Wales doubled between 2018 and 2022, largely due to the spread of synthetic opioids within illicit drug markets. Now, what's the community impact of it? Emergency services have reported a 20% increase in call-outs related to synthetic drugs overdoses in urban areas, particularly in Manchester and London. Let's consider the trend number two. This is the alcohol misuse. The COVID-19 pandemic led to significant changes in alcohol consumption patterns, with the UK now facing two major concerns. The first concern is binge drinking among young people. A 2023 study by Public Health England found that 34% of the 18 to 24 years olds engage in binge drinking at least once a month, often influenced by the social settings and nightlife culture. The rise of pre-drinking culture, where young people consume large amounts of alcohol before going out, has increased alcohol-related hospital admissions. Now, rising alcohol dependency in older adults is the second state. The Office for National Statistics (ONC) reports a 28% increase in alcohol-related deaths among adults over 50 since 2019. Now, many older adults developed a dependence on alcohol during the lockdown period, using it to cope with isolation, anxiety, and certain financial stresses. Now, let's talk about the community impact. The NHS reports that alcohol-related hospital admissions reached 980,000 cases in 2023, marking a 15% increase compared to pre-pandemic levels. The third trend is prescription drug misuse. The misuse of prescription medications such as benzodiazepine, Valium, Xanax, and opioids like codeine or tramadol has become increasingly hidden but dangerous issues in the UK. A study by the UK Addiction Treatment Centre (UKAT) found that 1 in every 10 adults in the UK has misused prescription medication at some point, earlier by exceeding the prescribed doses or by obtaining medication illegally. Now, online sales of benzodiazepine have tripled since 2018, with young people sourcing these drugs through social media platforms. Now, according to a 2023 NHS report, the number of individuals admitted for opioid-related overdoses increased by 23% in the last 5 years, with many cases that were linked to non-medical use of prescription painkillers. Now, how does this impact the community? Many overdose cases involve a combination of prescription drugs and alcohol, leading to an increase in accidental poisoning, especially among teenagers and the young adults. Let's consider the fourth trend, which is social media influence. The glamorization of substance use on social media has significantly shaped the youth behavior, encouraging the experimentation without fully understanding the risk of that experimentation. Now, viral TikTok challenges and YouTube videos featuring the alcohol binging or vaping have normalized risky behaviors among these teenagers. A study back in 2023, a survey actually by the UK Mental Health Foundation, found that 42% of the young people with the age bracket of 14 to 18 years have been exposed to drug-related content online, with 19% of them admitting they tried a substance after seeing it on social media. Now, drug dealers have increasingly used platforms like Snapchat and Instagram to sell illicit substances, making access easier than ever. Now, schools and parents, they are reporting an increase in substance-related incidents among teenagers, with a 12% rise in school suspensions linked to drugs and alcohol misuse in the last 2 years. Now, these trends actually demonstrate the urgent needs of the proactive community-based solutions. And by implementing targeted intervention programs, increasing the education on substance risks, and improving the access to mental health services, we can create a safer environment for individuals who are at risk. Let's further explore some specific actions communities can take to combat or to confront or to fight against these issues. Several steps could be taken, or these steps could be community-focused actions. First one is, we need to address substance uses requires proactive, data-driven and community-centered approaches. By implementing strategic interventions, we can reduce the harm, build the trust and empower the individuals to make healthier choices. Let us explore 4 key action steps that the communities across the UK can take to combat the substance use. Now, the first action step that needs to be taken is data collection and monitoring. Now, to address the substance use effectively, we need accurate, up-to-date data. Partnering with organizations like Public Health England and utilizing tools like National Drug Treatment Monitoring System, which is NDTMS, allows us to track the trends, identify the high-risk groups, and also to develop the targeted interventions. Several statistics have shown that according to PHE, in 2023, drug-related deaths in England and Wales reached for 4,907 in 2022, which is a 9% increase from the previous years. The ONS 2023 reported a 64% rise in fentanyl-related deaths over the past 5 years, emphasizing the urgent need for data-driven responses to synthetic opioid use. Another study by the UK Home Office found 18% of young people within the age bracket of 16 to 24 experimented with illegal drugs in the past year, highlighting the need for ongoing youth-focused surveillance. If data reveals an increase in ketamine use among young people in specific region, communities can prioritize school-based education campaigns, and along with that, they can increase the mental health support services. Now, similarly, if an area reports a spike in benzodiazepine misuse, partnerships with pharmacies and healthcare providers can help improve prescription drug monitoring. Now, the second step that we can take, or the second action step, could be community engagement. Substance use impacts every community in a different way. So, to develop effective solutions, we must listen to those most affected. Now, conducting surveys or hosting focus groups and engaging with vulnerable population, including the youth, the ethnic minorities, and economically disadvantaged groups, ensures that prevention efforts are relevant and well effective. Now, certain statistics in the study of 2023 by the UK Drug Policy Commission, it found that 76% of the people in deprived or underserved communities actually believe that there is a lack of local addiction support services in the community. NHS has also reported that young people from the disadvantaged backgrounds are 2.5 times more likely to develop substance use disorders. And this is actually due to poverty, unemployment, and lack of mental health resources. The race disparity audit in 2022 found that Black and South Asian communities significantly less likely to access drug treatment programs, despite experiencing higher rates of alcohol and cannabis dependency. Among several other real-world applications, in the communities with rising youth substance use, focus groups with parents and educators can help identify the social and environmental factors driving the trend. However, in the areas where cultural stigma surrounding the addiction, outreach effect can include collaborations with the faith-based organizations to encourage help-seeking behavior. Now, partnering with the local businesses and employers to offer job training programs can also reduce the economic stressors that literally contribute to the substance use. Let's step on to the third point, and the third action step would be targeted awareness campaigns. Awareness is the first step in prevention. However, generic messaging is often ineffective. Prevention campaigns should be substance specific, culturally relevant, and tailored to the unique needs of each community and each member of the community. A study by Alcohol Change UK found that nearly 40% of young people underestimate the risks of binge drinking, thus highlighting the need for better alcohol education programs. The UK Home Office also reported that social media exposure to drug-related content has increased by 32% between 2020 and 2023, influencing young people's attitudes towards substance use. Now, according to the UK government's 10-year drug strategy, peer-led interventions where individuals with lived experiences share their recovery journeys have proven 30% more effective than traditional media campaigns in preventing the substance use. If the synthetic drugs use is rising in a particular town, the social media campaigns featuring real-life stories of the overdose survivors can help deter young people from experimentation. Now, in the regions with high rates of alcohol dependency, the targeted campaigns in the local pubs or into the sporting events and the universities can actually raise the awareness about binge drinking dangers. So far, for high-risk youth, peer-led interventions such as former addicts sharing their recovery journeys can create relatable and impactful messaging. Moving on to the fourth action step. The fourth action step is localized preventive or prevention initiatives. Prevention or preventive efforts work best when they are tailored to the specific needs of a community. From harm reduction services to school-based workshops, localized initiatives can effectively address substance use and provide at-risk individuals with support they need. Let's dig into some statistics. A 2023 NHS report found that harm reduction programs such as needle exchange services and supervised consumption spaces reduced HIV transmission rates among intravenous drug users up to 40%. According to the UK Department of Education, schools that implemented early intervention workshops on drug misuse saw a 23% reduction in student substance use over a 2-year period. Now, localized addiction support services led to a 17% of decrease in relapse rates among the individuals who completed rehab programs, according to a study by the University of Manchester. The safe consumption spaces in cities like Glasgow and Bristol have successfully reduced drug-related deaths and provided access to healthcare along with the addiction support services. We need to understand that the school-based prevention programs such as the interactive workshops and mental health education have actually helped the students to develop resilience against peer pressure. So we can understand that the community-based recovery networks like the peer support groups and faith-based counseling have been proven highly effective in keeping the individuals engaged in long-term recovery. Now, we literally need to understand the benefits to the community through these steps. So, by implementing these community-focused action steps, we can first of all reduce the harm that is caused by that substance use by improving the access to prevention and treatment resources. Secondly, we can build trust between community members and public health organizations, now making individuals more likely to seek help. Thirdly, we can empower the individuals to make healthier choices, ultimately improving the overall well-being and safety. So now what do we get from this one? The fight against the substance use requires a united effort. It's never a singular or lonely effort. Through data-driven strategies, community engagement, targeted awareness campaigns, and localized prevention initiatives, we can create lasting change. Let's continue working together to build the healthier and drug-free communities. Moving on, we now have to look deeper into the strategies for the community leaders, what the leaders could do for us. Community leaders play a crucial role in tackling substance use by providing education, building the support networks, and advocating for policy change and creating the safe spaces. They can drive meaningful change and improve public health outcomes. Now let's just dig into the action steps for this one. The first action step is education and training. The community leaders are the backbone of every effective strategy. Now, proper training on the substance use, early intervention, and harm reduction will actually empower the leaders to recognize the warning signs and connect individuals with appropriate services before their situation worsens. Let's get into some statistics for this one. A study by Public Health England, PHE, found that only 38% of the community leaders felt adequately trained to support individuals struggling with the substance use. Because of that, early intervention can reduce the substance-related harm by up to 50% according to a 2022 report by the UK Advisory Council on the Misuse of Drugs, which is ACMD. The National Centre for Addiction found that individuals who receive early support are 35% more likely to complete rehabilitation programs, emphasizing the importance of frontline education. However, there are some local councils that can provide specialized training for faith leaders or for teachers and for the youth workers on how to recognize and respond to the substance use. Several workshops for employers can help them support employees struggling with addiction, reducing the absenteeism and workplace-related incidents. However, first responders and police officers can undergo the training on harm reduction and approaches for that to avoid the unnecessary criminalization and instead refer the individuals to treatment programs. Now, in this regard, the second step that we can take is establish the support networks. A strong community support system can act as a safety net for the individuals who are at risk of substance misuse. The faith leaders, the social workers, the youth mentors, and the trusted community together figures often serve as the first point of contact for those in need. So, by strengthening these networks, we can create an environment where people feel safe seeking help. In the statistics, according to UK Drug Policy Commission, 79% of the individuals recovering from substance misuse cite community support as a key factor in their success. Whereas NHS Digital reported that only 45% of individuals struggling with addiction feel comfortable seeking the professional help, which then emphasizes the need for informal support. A University of Manchester study back in 2023 found that the peer support programs reduced the relapse rates by 25%, making the community-led initiatives critical and available for the long-term recovery. Now, we need to understand that the faith-based organizations can provide the non-judgmental support and referrals to addiction treatment services, whereas the youth clubs and the mentorship programs can help the young people develop positive coping strategies in order to avoid turning to the substances for their survival or for their coping mechanism. Now, community recovery groups can provide the peer-led support, which has been shown to be highly effective in maintaining the long-term sobriety. The third action step would be policy advocacy. Now, as leaders, you have the power to push for policy changes that prioritize treatment over punishment and ensure adequate funding for local support services. Advocacy can create lasting, systematic change that actually benefits the entire communities. A Home Office report found that over 60% of the people in addiction treatment believe that stigma prevents them from seeking help, thus highlighting the need for policy reform. The UK government's 10-year drug safety programme committed £780 million to addiction treatment services, but many local councils report funding shortfalls, emphasizing the need for further advocacy. A London School of Economics study found that the public health-based drug policies reduced the substance-related deaths by up to 30%, reinforcing the effectiveness of harm reduction approaches. Digging into the further examples, advocating the decriminalization of drug use and promoting the rehabilitation-focused policies can actually help to reduce the incarceration rates and increase the access to treatment. Negotiating and lobbying for increased funding for local addiction services, housing support, and mental health care can create a more sustainable support system. Now, supporting the policies that integrate the addiction treatment into the NHS can ensure that substance use is treated as a public health issue rather than a criminal one. Let's jump to the action step number 4. We need to create safe spaces. Now, the community-based safe spaces provide judgment-free environments where the individuals can seek help, or they can simply engage with the support groups or access the essential services. Whether it's a drop-in center, a recovery cafe, or a harm reduction hub, these spaces can be life-changing. The NHS study found that individuals with the access to safe spaces for recovery are 40% more likely to remain sober for at least 1 year, which is a great achievement. Now, Scotland's first overdose prevention centre in Glasgow led to a 40% decrease in public drug use related deaths within the first year of operation. According to Mind UK, 65% of the people struggling with addiction also have the mental health conditions, emphasizing the need for integrated mental health and addiction recovery spaces. Now, when we take examples of the applications in UK, recovery cafes such as those which are piloted in London and Bristol, they actually provide the peer-led support like free mental health counseling and addiction resources in a welcoming, stigma-free environment. Now, drop-in centers for youth can help them or help prevent the early stage substance use by providing the mental health support, the social activities and mentorship program. If we consider the harm reduction hubs, including the needle exchange program and supervised consumption sites, they can reduce the overdose deaths and provide a direct path to treatment services. We need to consider their benefits to the community. Now, these 4 steps are actually beneficial. By implementing these strategies, the community leaders can reduce the stigma surrounding the substance use and encourage the help-seeking behavior. The leaders can also improve the access to treatment and mental health resources, particularly for marginalized groups. Leaders can also strengthen community ties, creating a more supportive environment for the individuals in the recovery. Now, this can also actually drive into the long-term policy changes that prioritize the harm reduction, and it can also prioritize the public health over the criminalization. So, what do we get from these 4 steps? We understand that effective leadership is essential in the fight against substance misuse, and through education, support networks, advocacy, and safe spaces, community leaders can make a profound impact. Together, we can build healthier, more resilient communities where all the individuals struggling with addiction receive the support they need. Now, the 5th and the most important step that comes here is collaboration and the success stories. So, while addressing the substance use effectively requires collaboration between multiple stakeholders. By working together through multi-agency partnerships, integrated care models, and along with that, the transparent data sharing, the communities can create the meaningful change. Let's take some time to explore the collaboration that drives to success. And in that collaboration, the first action step will be multi-agency partnerships. Well, no single organization can tackle the substance use alone. So by forming the partnerships with local councils, with the police, with the schools, with the healthcare providers, and along with that with the charities, we can take a unified approach to prevention, to treatment, and harm reduction. So joint task forces can streamline efforts, reduce the duplication of resources, and improve community outcomes. A report by House Office in 2023 found that the communities with multi-agency drug task forces reduced drug-related crime by 35%. According to NHS England, the coordinated interventions involving police, mental health services, and social care led to a 28% reduction in the drug-related hospital admissions. Public Health England found that the areas which are implementing the multi-agency collaborations saw a 50% increase in the access to addiction treatment programs, particularly in the underserved or marginalized or unprivileged communities. Moving on with the further application, the West Midlands Police and Public Health Partnership have successfully reduced the county lines drugs trafficking through joint operations with social services and charities, now helping at-risk youth to exit the drug-related activities. However, on the other hand, the Scottish Drug Deaths Task Force has brought together the law enforcement, healthcare providers, and recovery services to address the Scotland's high rate of drug-related deaths, leading to a 20% increase in overdose prevention initiatives. Now moving on to the local councils. Local councils such as in Manchester and Bristol have actually created the cross-sector partnerships to improve the substance use education in schools, reaching over 30,000 students annually. Second step that we could take into this is integrated care models. Now, substance use often intersects with mental health disorders, unemployment, and housing instability. So, integrated care models ensure that the individuals receive addiction treatment alongside with the mental health services or with the job training and housing support as well. Now, by addressing all these needs at once, we improve long-term recovery outcomes. However, the NHS England found that the 70% of the individuals with substance use disorders also have a co-occurring mental health condition that might be anxiety, depression, or any other trauma. Yet only 40%, the 40% of those receive the treatment for both. A King's College London study also found that the integrated care programs improve the long-term sobriety rates by 60% compared to the traditional single service approaches. Now, the UK government's 10-year drug strategy, which allocated £533 million to expanding integrated addiction treatment programs, recognizing their effectiveness in preventing relapse and reducing healthcare costs. The addiction or the AD action program in Cornwall integrates counseling, harm reduction, and employment services, helping over 1,500 individuals transition into the stable employment after their recovery from the addiction. While on the other hand, the Glasgow Community Addiction Recovery Services combines the addiction treatment with housing along with the employment support, leading to a 40% of decrease in homelessness among those who are in recovery. Let's talk about the Leeds Dual Diagnosis Pathway. This program actually connects the mental health services with addiction treatment, ensuring that the individuals receive comprehensive care rather than being bounced between the services. Let's move on to the action step number 3. The action step number 3 is sharing data and success stories. Transparency and storytelling are powerful tools in the fight against substance use. Now, by publishing the reports on program or the effectiveness of the programs and sharing the real-life success stories, we can inspire the communities to take actions and encourage the individuals to seek help. Positive case studies demonstrate the impact of collaboration and motivate the continued investment in prevention and treatment. Office for National Statistics report, it clearly found in 2023 that the substance misuse services with public impact reports saw a 30% increase in engagement, showing that the transparency builds the trust. Now, according to the Public Health Scotland 2022, 65% of the individuals in recovery said that hearing the success stories encouraged them to seek help for their own selves. Whereas the London School of Economics found that the programs highlighting the real-world recovery or the real-world recovery stories received 25% more funding and community support compared to those that do not. Let's dig into some more examples. The UK Recovery Walk, an annual event in the cities like Birmingham and Liverpool, shares the personal recovery stories and has helped reduce the stigma, leading to a 15% increase in treatment-seeking behavior. Another one, the You Are Not Alone campaign in Manchester features a real-life testimonials from people in recovery, increasing the help-seeking behaviors by 40% among young adults. If we talk about the National Drug Treatment Monitoring System, NDTMS, it publishes report on addiction treatment, success rates influencing the government policies, and funding allocations for rehabilitation program. Now we need to understand that what will be the benefit of these 4 steps to the community. By embracing the collaboration, we can firstly increase the access to treatment and recovery services, especially for the marginalized group. Secondly, we can reduce the crime, homelessness, and unemployment linked to the substance use through integrated interventions. Thirdly, we can inspire hope and reduce stigma by sharing the real life success stories. Fourth, secure better future and policy support by demonstrating measurable success. Now, what do we get from it? Substance use is a complex issue, but through collaboration, we can create the lasting change. Multi-agency partnerships, integrated care models, and transparent success stories all contribute to healthier communities. Now, together we can build a future where support is accessible, stigma is reduced, and recovery is celebrated. So, as we come to the conclusion of today's episode, I'd like to leave you with a thought. Addressing the substance misuse is not one-time effort. It is a collective journey. So remember, every action, whether it's raising the awareness, supporting someone in need, or pushing for systematic changes, every step counts. Together, we can make our communities healthier, stronger, and more resilient. We will be sharing the episode materials, including a summary of the key points and additional resources. If you would have any further questions or want to discuss any potential collaborations, don't hesitate to reach out to us. Thank you so much for being the part of this important conversation today, and we will be looking forward to work together to create the lasting change. Have a wonderful day.